This is an unbelievable story. What started out as an unthinkable undertaking actually became an amazing reality. A group of doctors and volunteers from the Mystic Aquarium performed dialysis on a 2,300-pound beluga whale who had kidney failure. They were actually able to keep the whale alive for an additional 2 weeks. It's never been done before. UConn Dialysis Center's medical doctor, Dr. Kaplan, played a major role in the procedure, and Dr. Kaplan joins us this morning. He's here with Mystic Aquarium's chief veterinarian, Dr. Allison Tuttle. Good to see the two of you. Thanks for coming by and telling us about this. Never been done before, doing dialysis on a whale of this size. No.
No, not been done. Not been done. And
so what was the procedure? What did you have to do?
Well, the animal was trained. Allison had trained the animal to swallow a tube, and from that tube we could infuse a chemical solution. That solution would go into the stomach and follow down the intestine, and while it does that, it draws out the poisons associated with kidney failure.
How did you realize that this whale needed dialysis and that it had kidney failure in the first place?
Yeah, initially the trainers just mentioned to us that the whale wasn't eating his full diet and was acting slightly abnormally. So in that situation, we always take a blood sample to assess the health of the animal. And unfortunately, what we saw on his chemistry panels was an elevation in the waste products that the kidneys would normally excrete. Therefore, we knew that he was in acute renal failure.
So how did you figure out what to do and how to do it, since this has never been done before?
Well, that's a great question. I mean, your initial approach to treatment is to give fluids, and what we weren't seeing is any sort of improvement with fluids. Now, Mystic Aquarium has a memorandum of understanding with the University of Connecticut for the past couple years, and that's paved the way for a lot of collaborations in terms of research, education, and exhibits. So, and we were looking for a renal expert who could potentially guide us in where to go next with this treatment. It was a natural choice for us to look to University of Connecticut and Dr. Kaplan for all of his expertise.
It's a lot different than when a patient goes in for some dialysis, right?
Well, dialysis normally is we clean the blood with a machine, and that requires access to the blood supply. Sometimes we do peritoneal dialysis in humans, where you put a catheter in the belly and wash water in and out. Neither one of those procedures would have been practical in a whale that's swimming around, because both of them require a catheter inserted into the skin. So what we decided to do was intestinal dialysis, where we used the gut as a way of washing out the poisons. Again, never been done, but turned out to be very practical for this animal. We were able to control the poisons very well with this procedure. It was labor intensive. Dr. Tuttle and her staff were dealing with the animal 4 or 5 times a day.
Are you in the water and holding and doing all kinds of things?
Yes, absolutely. Right. A large team of staff and volunteers were in the water supporting the animal and keeping him still throughout the procedure, and that's where we administered the medication. It would have been very stressful to take the animal out of the water for all the procedures.
Unbelievable. Dr. Tuttle, Dr. Kaplan, thanks for coming in.
Thanks
Congratulations.
for having us.
The whale lasted another 2 weeks, so that was good. And the first time this has ever been done. You're making history down there in Mystic Aquarium. Good to see the two of you.